In this video we will talk about typhoid fever, so let's start. Salmonella typhi is a bacteria which causes typhoid fever, which results in a systemic illness with fever and abdominal pain. Now coming towards the transmission of typhoid fever, so its transmission occurs via fecal-oral route, contaminated food, or by direct person-to-person contact, for example by direct handshaking with infected person. Now what it is clinical presentation of typhoid fever. So Salmonella typhi when enters the body, so it have incubation period of 5 to 30 days in which there are no symptoms present, but after the symptoms onset takes place after 5 to 30 days. So in the first week there will be a rise in temperature takes place, relative bradycardia. Sometimes the patient will be complaining of constipation and sometimes complaining of diarrhea, and it will be pool smelly pea soup diarrhea. So these are the symptoms which occurs in the first week. In the second week patient will be having persistent fever, in which a stepwise increase in fever occurs. For example, in the morning the patient will feels good but gradually will start increasing throughout the day till evening. Second symptom is rose-colored spots around the navel, and the other symptoms are coated tongue, yellow-green diarrhea or constipation, delirium, coma. In week 3 clinical features of week 2 will be present, plus there may be gastrointestinal tract ulceration, Peyer's patches, perforation and enlargement of liver and spleen may occur. Blood cultures is the most important diagnostic tool, and stool cultures are often negative despite active infection, and the other is Weedel test, which is no longer recommended because it is less specific and less sensitive. Now coming towards the treatment of typhoid. So we can use ciprofloxacin 500 mg BD orally for 10 days, or cefixime 200 mg BD for 10 to 14 days, or ofloxacin 400 mg BD for 10 days, or azithromycin 10 to 20 mg per kilogram per day, with maximum of 1000 mg per day. While in severe typhoid, injection ceftriaxone 2 to 3 grams IVOD for 10 days, OR injection cefotaxime 2 grams IVOD for 10 to 14 days, OR injection meropenem 1 to 2 grams IV every 8 hours for 10 to 14 days. So this was all about today's topic. For more informative videos, please subscribe to our channel and press the bell button. Thank you.